Well, the key success has been the reduction in the number of uninsured Americans from just under 50 million down to an estimated now about 29 million. So we've seen a significant increase in the tens of millions of people who have health insurance, and we've gotten the rate of uninsurance down to the lowest rate since we've been counting. The other big piece is that we are seeing a significant transformation in medical care delivery in the United States. It's going in some ways very slowly, in other ways at breakneck speed. But we are moving our system away from a system that rewards medical providers for how much they do, and we are now increasingly more and more day by day reimbursing providers based upon the value and the quality and the outcomes for the services that they provide. And that is a major transformation in our healthcare system that's going to be increasingly important in years ahead, and at some point will probably even overshadow the coverage parts of the law. There is no evidence that the implementation of the ACA has had any negative consequences in terms of the job market. We've now had about 69 months of steady growth, and the highest growth in employment has been in the past 2 years when the ACA was really taking effect in its full way. So the actual cost of the law itself to the federal government has been coming in significantly below the projections from when the law was signed, in the hundreds of billions of dollars. So it's a significant. Now, that's not all good news, because part of the reason it's coming in less is because there are actually fewer people who are taking coverage under the law than had been projected. But we've had 5 years of extraordinarily low rate of healthcare inflation compared with what people assumed was going to happen. Now, that doesn't mean that people are not seeing higher premiums, deductibles, and other forms of cost sharing in various parts of the job market. People are, and that's a real concern, but in terms of the overall impact of the health sector in the ACA on the overall economy, it has been much lower and steadier than I think even the champions of the law predicted would happen. The future of the ACA depends on what happens on November 8th. I had thought, once we got past 2014, that all of the major existential threats to the ACA were over, and I was wrong. There's one more, and it's on November 8th. If Republicans win the White House and hold on to the Senate and the U.S. House of Representatives, then I believe there will be some significant and substantial dismantling of major parts of the law, including coverage, which could lead to a loss of insurance coverage for potentially tens of millions of Americans. The Congressional Budget Office said that the recently passed legislation that the Republican Congress sent to the President Obama that he vetoed would have taken coverage away from 22 million Americans. So big consequences. If Democrats hold on to the White House and/or the U.S. Senate, then I believe they will be able to effectively block that kind of substantial dismantling. So the consequences for the ACA from the November 8th national elections are momentous.